Now, where do you want to start when it comes to Rishi Sunak's first 100 days? Because, to be fair, Keir Starmer's first 100 days were pretty anonymous, weren't they? So at least Rishi is doing something.
Well, Starmer started off in the backdrop of the COVID pandemic, and he was lost to the public mind because we were all focused on other things. I mean, if you look at his record since then, he's done rather better. I thought Rishi's performance last night strangely unprofessional for a man who is supposed to be so slick.
Unprofessional?
Well, it felt to me like the work experience kid had wandered in front of the auto cue by mistake, you know, a bit like an A-level student.
It's the dull men's club at the moment now, I think, for me, and I'm not just blindly defending Rishi. In fact, far from it. I think his performances in front of camera have been incredibly stilted, not inspiring whatsoever. Keir Starmer, to be fair, I don't think he exactly lights up a room, does he?
No, but I suppose, you know, if you were to become the Prime Minister, you do then get all of the panoply of support as PM, you get the red boxes and the cars and the international travel. Okay. Rishi seems to be diminished by becoming Prime Minister. Right. He seems to be less of an effect.
It is interesting. I do wonder if he'll grow into it. In terms of his priorities, they call it the top three... the top 5 priorities. You can condense them into 3, basically. It's the economy, the NHS and migration.
The broadcast had 3, because that's all we can take for a...
Well, that's it, exactly. Yeah. But also, it's not top 5, just squish it down into 3. It's easier to remember anyway, isn't it? When it comes to the NHS, to start with, Rishi Sunak has got a tricky situation because we are hearing things like if you had a heart attack, I know a lot of our viewers and our listeners have been in situations with loved ones like this where they've called an ambulance, waited 90 minutes, sometimes the person has not survived that as well. GP appointments have been backing up, NHS waiting times have been backing up. So he's got to fix the NHS, which is in crisis. Do you think he's got any way of actually doing that?
Well, doing a broadcast isn't going to help. And the problem, you know, he goes on the telly to talk about the crisis, blaming it on the pandemic, by the way, but other health services are not in the same crisis as ours. Doesn't even mention the strikes in the NHS, you know, on the day when there was actual ambulance drivers' strike going on. I thought that was an odd thing to do. Even the Daily Mail has pointed out that's a strange thing to do today. So that was odd. And then, of course, the other elephant in the room for him is his own use of the private sector. Now, there's nothing wrong with that, but if you're the Prime Minister, you would sort of hope that you knew how the NHS worked and involved yourself.
Can I just say there's something a little bit disingenuous about all of this, Paul, because there's a lot of media companies out there, and I happen to know some of the left-wing ones as well, where they give all of their employees private health care. And so they might be, for example, saying things on the front page like, we are with you, to a load of nurses, but they're not with them in A&E.
But the British government doesn't provide private health care to its employees, does it? I mean, if you're the leader of the nation, you're supposed to use the national...
But, I mean, if he had a heart... But the point is...
So how does he understand the experience you've just described of people waiting? Because if he wouldn't need to...
No, sorry, is it not a little bit of a misconception, this? Because if he had a heart attack, he would go to the NHS. He wouldn't call Bupa, would he? So presumably he would have some experience. It's if he wanted an elective surgery... Well, yeah. If he wanted some elective surgery, then he's taking the pressure off the NHS.
Sure. But the broader point I'm making is he's out of touch. And there's experiences that your viewers will experience of not being able to get a GP's appointment, not knowing whether an ambulance will turn up or not for their granny when she's had a fall. You know, he doesn't understand those things, so he doesn't experience them. So the substance of last night's broadcast was very much, trust me, look at me, my dad was a doctor. But people will be asking, OK, but what are you going to do? What's the substance of it? It was not particularly well spun.